Back. Well, millions of Americans rely on statins to help reduce their cardiovascular risk, but a new study is now shedding light on gaps in awareness and testing that could impact patients. Internist and clinical immunologist Dr. Tania Elliot is here to explain. Doctor, thanks so much for joining us. Could you tell us a bit more about this new study?
Sure. Thanks for having me. So the study was conducted by Doctors Best to get a better understanding of what people think of their heart disease risk. Is it a concern? Is it an issue? Are they worried? Right. And then also to understand in general people's awareness of this important compound for our muscles called coenzyme Q10. So let me start there. What is coenzyme Q10, right? It's an essential compound that our muscles need in order to create energy. And the highest concentration of coenzyme Q10 is in our heart. And it's also present in also other muscles. So going to the study, 60% of survey respondents, this was a study conducted by Doctors Best, which is a high quality supplement brand, didn't even know their heart disease risk. We know heart disease is the #1 killer of Americans. 60% of those survey respondents didn't even know their risk. 50% of Gen Zers, right, these are under the age of 30, were actually worried about their heart. And they cited stress as the #1 risk factor, chronic stress that was contributing to fatigue and not feeling well. And then 17% of those Gen Z survey responders were actually taking a statin. And a statin is the most commonly prescribed medication to lower cholesterol levels and reduce cardiovascular risk. Now, inadvertently, those statins also reduce coenzyme Q10 levels, which again is an essential compound for energy that's found in our hearts, in our heart muscle, as well as our other muscles.
Okay, so now knowing this, what steps can people take to help decrease their heart disease risk?
Well, first things first, if you're on a statin, it's important to have a conversation with your doctor to understand, should I be on coenzyme Q10? Because studies show that people with cardiovascular disease actually have better outcomes when they are on coenzyme Q10 supplementation. CoQ10 is something that's found in foods, but the most common food it's found in is organ meat. And I don't know too many people that are eating organ meat on a regular basis. So having a conversation about whether coenzyme Q10 might be right for them. Also, people who are on statins and are experiencing muscle aches and pains, which is a common side effect. Well, remember, coenzyme Q10 is also found in our muscles. Statins lower that coenzyme Q10 level. Coenzyme Q10 supplementation may help with those symptoms, so having a conversation there as well. And then in general, right, 60% of those survey respondents didn't know what their heart disease risk was. They need to know their heart disease risk because one person dies every 35 seconds from a heart attack or heart-related condition. So it's really important to understand your risk, check with your doctor, get tested, get your cholesterol, your blood pressure, get checked for diabetes, and have that conversation. Show up as that informed consumer.
Yeah, all really great information. And as you mentioned, this affects a lot of people out there. So where can people watching today go to learn more?
They can check out doctorsbest.com to learn more about coenzyme Q10 and also about heart disease awareness.
Wonderful. Dr. Tania Elliot, thank you so much for the valuable information.
Thanks for having me.